Hello, welcome to my channel, 2 Minutes Concepts. I am Dr. Shoaib Mehsud. Today, we will do a quick revision of streptococcal skin infections. First is Impetigo. It is a superficial skin infection, often in small children. There is presence of brown, crusty, vesicular lesion that may have some systemic symptoms. Itching and pustules may develop. Second is Cellulitis. It is a serious bacterial infection that presents as a poorly demarcated swollen, erythematous area that is painful and warm to touch. Erysipelas is sharply demarcated. Systemic symptoms may be present for both. Third is Necrotizing Fascitis. It is also called flesh-eating disease. It presents as the death of soft tissue that may look red or purple with severe pain. Fourth is Perianal streptococcal dermatitis. It is an infectious condition around the anus in children caused by group A streptococci. It usually present as a sharply demarcated redness in the anal region with itchiness. And the last one is eczema. It is an infectious condition that is characterized by crusted sores with ulceration. This is a deeper form of impetigo. I hope you have enjoyed this video. If you have any question, you can ask in the comments section. Thanks for watching, and don't forget to subscribe to my channel.